Good morning, everybody. Let's take our seats. Time to begin. Good morning. I'm George Isham. I'm the chair of the Institute of Medicine's Roundtable on Health Literacy. And it's with a great deal of pleasure I welcome you all to today's workshop. I also want to let you know that this meeting is being both recorded and videotaped, so you should be aware of that. Our mission as a roundtable is to inspire and activate a wide variety of stakeholders to develop, implement, and share evidence-based health literacy practices and policies with the goal of improving the health and well-being of all people. As one of our major activities, we sponsor workshops for members and the public to discuss issues of importance and concern as they relate to the field of health literacy. As many of you know, 10 years ago, the Institute of Medicine released the consensus report, Health Literacy, a Prescription to End Confusion. In that same year, the Agency for Healthcare Research and Quality published a systematic review and analysis of evidence about the relationship between health literacy and health outcomes and the effectiveness of interventions to mitigate the impact of low health literacy or low literacy. In that same year, the National Institutes of Health and AHRQ announced the availability of funding for research on health literacy concepts, theory, and interventions as they relate to the Department of Health and Human Services public health priorities. The purpose of this workshop is to focus on progress made in the field of health literacy since that time, to explore the current state of the field, and to discuss possible directions for future health literacy efforts. The workshop was organized by a planning committee whose members are Louis Bravo, Terry Davis, Ruth Parker, Michael Pash-Orlow, Scott Ratson, Rima Rudd, Winston Rong, and myself. And I might comment that 10 years has passed. We've made a lot of progress, I think, in health literacy. The Roundtable was founded, established shortly after the report was issued, and we've continuously had workshops and discussions. And I think the field has moved a considerable amount in this last decade, some of it as a result of our activity. So it's very, very appropriate for us to pause and take note, see where we've come, and to reflect upon what we hear today and talk about what the future challenges and future opportunities are. And so I do want to alert all the members of the Roundtable to be thinking carefully as the day goes on about the key points and takeaways that are important to highlight as a result of this discussion today. At the end of the day, I will be asking each of you to provide us with one or two comments about the important points made. As you know, this reflective activity as well as the presentations combine to make an excellent summary of our activity. And as we circulate this material, both in printed and hopefully recorded form, this hopefully will stimulate further dialogue in the field. So